Hi everyone, in this video we will discuss about the chest X-ray features of aortic dissection. So first of all, mnemonic. So mnemonic is D webs. So first of all, D for the dilated aortic arch. It can be present on the chest X-ray. Next one is the W. So W for the widened mediastinum. This is the another feature of the chest X-ray of aortic dissection. Next one is the E. So this is the double E. So first E is the effusion, and this is the pleural effusion which can be present on the chest X-ray. The second E is the effusion, and this is the second type of effusion, like the pericardial effusion. So the second last is the B. B for the blurring of the aortic contour. It can also be present on the chest X-ray. And the last one is the S. So S for the separation of the intimal calcification. So this is the intimal layer of the blood vessel, and there is a separation between the intimal calcification. So this is the D Webb's mnemonic for the chest X-ray features of aortic dissection. So I hope this video is very useful for you to understand, and if you like this video, please share it to your friends. If you have any question, you can comment below. You can subscribe our channel for more mnemonic videos. You can join our social media pages. All the links are given in the description. Thanks for watching.